Hello and welcome to the channel where we discuss medical topics and lifestyle. In today's video, we are talking about the functional medicine approach to diverticulitis and diverticular disease. We're going to dive a little bit deeper when it comes to functional medicine in comparison to some of our other videos regarding this topic, which you can check out. But to start us off, we're going to jump into some definitions. We won't go into too many details in comparison to the other videos, but just a quick breakdown, and then let's get into the functional medicine approach regarding the topic. So, diverticular disease, which is small bulging pouches of the inner lining of the colon or large intestine, they push out, right? So the pressure of the stool, pressure within the lumen of the gut causes these outpouchings in your colon. And diverticulitis is a step further where there's inflammation and infection of these pouches. So these are very basic definitions. Again, going more into detail in the other video, but these are the basic definitions for the purpose of the videos. Now let's dive right into the lifestyle and the risk factors. So basically, we live in a world where our guts are being tortured. Our gut microbiome is being tortured. There have been numerous studies done, where you can compare the genetic pool from the same genetic pool from people who are hunter-gatherers, for example, in very rural areas, and where they have moved to urban settings. And you can see that the average stool weight for the hunter-gatherers was about 2 pounds per day, meaning so much fiber. Average stool weight for the city dweller or the urban dweller was about 4 ounces. So that's 4 ounces versus 32 ounces, a huge difference. Similar studies were done. There's a study done between the same kind of a group between the UK and Uganda, where in the UK, the average stool weight was about 110 grams, and in Uganda it was 400 grams. So you can see that this is truly a Western illness and a byproduct of the way we are living our lives. So let's break these lifestyle and diet risk factors down into a conventional medicine approach and how we would treat this story. So we have the diet side of things. So we have eating a diet that is high inflammatory fats, low water, low fiber. So all these red flags when it comes to the development of diverticular disease. We have lifestyle factors. So low exercise, smoking, all these things are risk factors and provoke it. Medication. So we're talking about aspirin, your Advils, your ibuprofens, your opioids, constipators, all these things that tackle it. Then we have age. So 75% of people above the age of 60 are going to have diverticular disease. It's a striking similarity throughout the Western world. So diet causes these things, and with age, they come along. Medication, lifestyle, and all these things. So what happens? You go to visit your doctor. You're having a little bit of it's coming. So you've had the colonoscopy, for example. You've had the scan. It picked up diverticular disease. You know it's coming. So it's rumbling. It's not severe. So you go see your doctor. What does the doctor do? Tells you to rest, give you some painkillers, give you some antibiotics if you need it, advises on your fiber a little bit, advises on, maybe gives you a liquid diet. And that's the advice that the doctor gives. Hopefully you avoid the hospital, and that's about it. But once you sort out the episode, the blip, the bump in the road, what ends up happening is the cycle just repeats, right? Because you go back to that kind of risk factor picture with these categories that we just mentioned. So we aren't actually solving the problem. We're just putting a band-aid on it, rather, until the next time it occurs. So now we have to dive a little bit deeper. So we have to actually talk about overall gut health. And because the aim of the story is to not let this happen again. I mean, we haven't even touched upon complications of diverticular disease. We'll make another video on that, but we haven't even touched on that. So now let's talk about the functional medicine approach to this kind of a situation. So yes, when we're having a blip, when we're having this bump in the road, we can definitely approach the situation with a little bit of a liquid diet, right? So reducing the amount of fiber and then slowly reintroducing it. We made a whole nother video on this, but we need to dive a little bit deeper because this doesn't actually solve the root cause of the issue, which we just mentioned a minute ago. So let's illustrate this a little bit better. So let's say we have a 60-year-old lady with arthritis. Maybe she's waiting for an operation. She takes painkillers daily for the pain. She's constipated her whole life. She knows she has diverticular disease, but she has these IBS type of symptoms, and she gets a flare-up one time a year. So this is the picture of the person let's say we're dealing with this kind of a person. And then we have this individual coming to you saying, oh, my stomach is hurting. I'm getting a little bit of a flare-up of my diverticular disease. And we're going to manage it with a liquid diet and reducing fiber and reintroducing fiber on the basis of all these red flags we've just heard, all these lifestyle factors we've just heard, all the risk factors we've just heard. So fiber alone cannot tackle the entire issue, unfortunately. When you just change the fiber in an individual like this, and a lot of people are like this, unfortunately, then it's not the pure solution just to tinker the diet a little bit and take some painkillers when the flare-up happens, when the bump in the road comes along. We must think deeper to solve this problem. So we have to think about the gut microbiome, how we're going to optimize this person's gut to not allow this to happen, because they have a lifetime of this going on. So we have to think about their gastric motility, their transit time, how much of a leaky gut there is, how much dysbiosis there actually is. Is there anything else going on like SIBO, small intestinal bacteria overgrowth? So there's so much to do here, so much to optimize, that a lifetime of this cannot be just fixed by tinkering with the diet a little bit when the episode occurs. So let's combine everything and treat this person differently. So let's prevent disease and optimize gut function so these things don't occur again. So diverticular disease doesn't flare up again and doesn't complicate things with an abscess or a fistula or perforation, which means big surgeries. So how are we going to treat this person? So the first lifestyle factor to manage is stress management. So this is really important because cortisol has a direct impact on the makeup of the microbiome. It can lead to a leakier gut and inflammation, and that's when the cascade starts towards the infections becoming more prominent and the diverticulitis occurring. So the aim is to prevent disease and optimize gut function. That's the aim of the game here. This, what I just said, many doctors don't even speak about. For example, you don't even get told. It's a simple lifestyle measure. How does cortisol impact things? This is something we need to address. Not many people talk about it. Then we have the other lifestyle things to discuss. So the other lifestyle factors to tackle, for example, in that lady was, you advise them not to smoke. If they do smoke, you advise them to exercise more, go for a walk, things like that, and medication. So if we recall with our lady example, she's taking loads of painkillers for her arthritis. So let's cut that out. Let's look for some alternatives and things like that. Then we have to talk about optimizing the gut. So yes, we do incorporate the initial management plan, so the liquid diet, the fiber adjustments. So we'll get to that in a moment. But absolutely, we need to do that early on when the bump in the road is approaching or when we feel it coming. But then we can go a step deeper. So we can examine the stool, for example, so we can see what is going on in there. In addition to doing a blood test, because the diet we have today has inflammation that we just don't know about, right? It's an inflammatory diet, or we do know about it rather. So 50% of these patients with IBS kind of a picture, constipation, they have actually something called SIBO, so small intestinal bacterial overgrowth. So a stool test can point us in the direction of maybe tracking that down. We need to reduce the amount of inflammation. A stool test and a blood test can show us that. We need to address the gut motility. So that's the MMC, the migrating motor complex, which I'm sure many people haven't even heard of ever in their lives. So when you stop eating for about 90 to 120 minutes later, there's a signal. That's the MMC, which kind of does a secondary sweep of your bowels. So if you think about it, if you connect the dots there, the more you snack, the the less likely this gets activated, and then the more debris gets remaining in the intestine somewhere along the way, and then you can have bacterial overgrowth and trouble can occur. So many things to discuss, so many things to optimize. So now, what to do when you feel it? So what to do when you feel this bump in the road coming along, when you feel an episode of diverticular disease coming along? So what are we actually going to do? Here's a practical example. The first thing we actually need to do as a blanket statement is dispel the nut and seed myth that we read so often about. So they won't provoke a diverticulitis flare up. They won't cause your symptoms to get worse. In fact, research shows that there's high levels of omega 3s, anti inflammatory components, and they are all beneficial in nuts and seeds. So please eat them to your heart's content. So if we feel a flare up coming on, the first thing we can practically implement at home is to adopt that liquid diet and to reduce the amount of fiber there. So liquid diet sounds hard, but you can do it. You can do something like bone broth, for example. It's huge in nutrients, nutrient powerhouse, antibacterial properties. Swap it over to a liquid diet. Clove tea, really high in polyphenols. Peppermint also has this, really good for restoring the gut microbiome and the health of your bacteria down there. You can do this for a few days and you will feel the pain probably diminishing a little bit. Then you can slowly start to add in some fiber to the diet. So you can start off with soluble fiber, which forms a gel. It slows digestion. It feeds the bacteria. So things like apples, artichokes, barley, berries. And then as the days go on, you can throw in insoluble fibers. So they absorb the water. They help move food and waste along. They prevent constipation. And then we do things to optimize the actual gut. So we can incorporate glutamine, for example, fish oil capsules, for example, as well, targeted supplements that are healthy for the gut. Curcumin is hugely anti-inflammatory, and it's been there's research articles relating that to ulcers as well. Ginger and artichoke, we mentioned a little bit, and 5-HTP as well. So there's a lot that you can do to lay the foundation of treating the acute flare up. And of course, if we need to, we go to our doctor, we get antibiotics if it's getting terrible. But when you feel it coming on, you can do some really practical things at home, and not just to treat the acute thing that's going on, but also lay the foundation of optimizing your gut and changing your lifestyle and your diet so these things do not repeat themselves in the future, to minimize the chances of repeating themselves in the future. So there you go. You have a different approach to approaching the entire situation. There's always another layer to add. You get to the root cause in a way and sort out the problem. So hope you learned something in this video. Please like and subscribe for more. Comment in the section below. I'd love to hear your opinions on it. And let's see you in the next video. Take care.